TV. We are here today with Dr. Michael Wald, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine of Mount Kisco, PC. Our topic today is diabetes. What is diabetes and how does it develop?
Well, there are a couple of different forms of diabetes, but I'll talk about the most common one known as diabetes mellitus, which is type 2 diabetes. And this is a form of diabetes that quite a large number of adults tend to suffer from, particularly in the United States. And it should be noted that between about 18 and 35% of children are suffering and newly diagnosed with diabetes. So this is a condition that is horrifically on the rise. What diabetes is, in a nutshell, is blood sugar that is too high. So when blood glucose, which is blood sugar, gets too high, it damages a variety of tissues. It can damage arteries, the kidneys, the eyes, and diabetes. Having diabetes is equivalent to having cardiovascular disease. So, and diabetes also can create all sorts of issues with the nerves in the body as well, commonly causing something known as diabetic neuropathy, which are painful inflammations which are often irreversible in diabetics, but also numbness and just weird sensations throughout the body as high blood sugar damages tissues.
When a person is recently diagnosed with diabetes, what lifestyle changes become necessary?
Well, the first thing that should happen once someone becomes diabetic is to determine what role that the diet might play in either having caused the diabetes or perpetuating the diabetes. Believe it or not, there are other factors that can cause diabetes. For example, environmental pollution, breathing pollutants is known to cause diabetes, even with a perfect diet. So for those of you out there that just cannot understand how their diets may have caused diabetes, your answer could be pollution, as strange as that might sound. And then other lifestyle habits would be additive in terms of causing diabetes in a susceptible person. But most type 2 diabetes these days is caused by improper diet. In the United States, what's known as the SAD diet, SAD, or the standard American diet, which again consists of saturated fats and trans fatty acids and an abundance of refined and processed carbohydrates and overcooked foods and meals that are too big. So when a person has diabetes, the first thing is they want to incorporate healthy proteins in their diet, and they want to be grazing throughout the day. They want to have 4, 5, 6 meals roughly evenly spaced throughout the day. They need to be mindful of eating foods that are low on what's known as the glycemic index scale, which is a scale that estimates how the body should respond to foods in terms of it raising the sugar too dramatically. But don't just go by these glycemic index scales. It's important for a person who's been newly diagnosed with diabetes to see whether or not they, as an individual, actually do adversely react to foods as they're laid out on these glycemic index scales. And of course, eliminating all refined and processed sugars is a must in diabetes. Improving the diet overall by increasing the number and types of fruits, vegetables, nuts, seeds, and grains in the diet, with the possible exception of eliminating gluten, because gluten can actually be a cause of diabetes or may exacerbate the problem. Exercise, of course, is essential for diabetic management. A regular routine of exercise helps reduce the complications and helps blood sugar balance. So these are just some of the highlights. And of course, there are nutritional supplements as well, which range from the use of fatty acids to protein supplements to something called vanadium, chromium picolinate, zinc picolinate, or taking whatever nutrients your laboratory work says that you, as a diabetic or someone who's wishing to avoid diabetes or improve their blood sugar, should do. So that's based on individual testing and may not be found in some book chapter on diabetes.
What differences in the holistic approach should be taken between type 1 and type 2 diabetes?
Well, those are two different types of diabetes. Type 2, as I mentioned, is the most common form, and how that's treated in traditional medicine, it's a form of hyperglycemia or high blood sugar, is the practitioner will generally tell a patient that diet and exercise should be looked at, whatever that means. They don't usually give a lot of feedback, But what they mean to say is eliminating or reducing sugar in the diet, but they mostly seem to be aware of having the person eat meals regularly spaced throughout the course of the day and increasing their protein intake and forms of healthy protein. Proteins help to slow down the spilling of blood sugar, or I should say from glucose from the digestive tract into the blood. So when you have a higher protein diet, that helps slow that process down, which helps prevent some of the adverse increases in blood glucose. And the treatments in traditional medicine also usually involve either insulin or some insulin-type medication, or medication like metformin, which helps increase insulin function in the body, or what's called reducing insulin resistance. Insulin is the hormone that is involved in blood sugar balance. That's diabetes mellitus. Diabetes insipidus is a whole other type of diabetes, which is a hormonal problem that, in my opinion, natural medicine cannot help very much, and a person probably should rely more on traditional treatments for that condition, which are quite complex.
This has been Dr. Michael Wald.